Hi, my name is Maritza Duran from Emden Consulting Services, and I have been helping dental practices for over 15 years through the operational development of their startups. Avoid stressful situations and loss of revenue by implementing the following 6 steps on how to properly discuss out-of-pocket responsibilities with your patients. The rapid growth of the insurance industry, accompanied by the complexity in which they operate, causes significant loss and distress in all healthcare businesses. They have become what I call the necessary evil of our time. Whether we like it or not, insurances are here to stay. Just look around you. From a consumer's perspective, most of us have insurance and we certainly want to save money by using it. Now, as a business owner and healthcare provider, understanding the basics of insurance companies not only benefits your bottom line, but it also improves the overall patient experience, which allows you to stand out in this highly competitive market. Here are the 6 steps for you to have a good patient relationship. Step number 1, collect as much information as possible from the patient. When a patient calls an office, we tend to be very task-oriented. We may use a script for answering the phones properly, but when it comes down to it, we often fail to connect with our patients during that initial conversation, and we risk missing out on information that could help us customize the insurance verification process and prepare accordingly. Ask questions like, "What brings you to our office?" or "Tell me a little bit about your past experience in a dental practice." This is a great opportunity to connect, collect, and prepare for the following steps. Step number 2, use a tool to verify patient benefits prior to confirming their visit. You may want to customize and implement the use of an insurance verification form to collect the relevant information from the patient. This includes insurance information, personal information, and notes regarding the specific reason for their visit. With this information at hand, reach out to the insurance companies to confirm patient eligibility and get a complete breakdown of benefits. Focus on the special notes taken and go the extra mile for your patient and your dentist. Also, your office participation and status and assignment of benefits, and any out-of-pocket responsibilities specific to the purpose of that visit. Step number 3, or tip number 3, review and explain findings with the patients upon arrival. Make sure you greet your patient with enthusiasm. Energy is contagious. Have the information ready for review and present to the patient. Ask them questions like, "Mr. or Mrs. Smith, do you understand how your insurance works?" They will, if they say yes, continue with a "Great, now let's review it together and see what is expected to happen today and how it will be covered by your insurance." If they say no, take the approach of the teacher, the educator. Say something like, "Let me show you how your plan works. I'm here to answer any questions to help you better understand how everything connects." Step number 4, advise patients of payment options available and collect. I remember this script that was in this 40-year-old practice back in 2003. The script went something like this. "For today's visit, which you can choose to pay using check, credit card, or cash, we will be performing a root canal, which again you can pay using credit card, check, or credit. Is your preferred method of payment cash, check, or credit?" You may want to modify this by adding the expected coverage of the plan, but still the point is stressing your payment options. You may also want to add that in order to facilitate faster checkout, you recommend that prior to starting treatment, they pay. This will ensure that they're not standing around in discomfort after treatment, and the exit conversation is being structured around their experience, potential reviews, and referrals to your practice. Step number 5, maximize your internal communication. Oftentimes, treatment plans change and we have to modify the patient's out-of-pocket responsibility. Nothing is more frustrating to a patient than being quoted a fee and then sitting in the doctor's chair to find out the cost is higher. Some patients tend to only want to receive the services covered by their insurance companies. And this is where an outstanding office separates from the masses. Having the skills to educate your patients in the importance of treatment and making their insurance compensation secondary to care is the key determinant of your success. It is imperative that you and all members of your team, clinical and administrative, are all trained to reinforce the importance of care and work in congruence with one another. Aim to have a clinical team updating the front desk of any last-minute treatment plan changes and have that financial conversation prior to any work being done. Step number 6, predetermine any large treatment plans. After the patient's initial visit, once you have been given a treatment plan from the dentist, for all procedures exceeding $500 or $300 and higher, it will be a good idea to request a predetermination of benefits from the insurance. A pre-authorization is how a procedure is covered, while a predetermination is a comprehensive alternative which provides far more information to both the patient and the provider for case presentation and financial discussions. Are you enhancing the perceived value of your practice by mastering your insurance participation and improving patient satisfaction? Competition is fierce and insurance companies are complicated. We owe it to our businesses, our team members, and most of all our patients to understand and address insurance-related costs of treatment with certainty and professionalism. If you want your patients to recommend their friends and families to you, let a beautiful smile be the only surprise they get in your practice. And remember, an educated patient is your best client. Thank you so much for watching this video. I hope you have found it useful. Again, if you liked it, don't forget to like it and subscribe. I'd love to connect with you and make more videos specific to your needs or your questions. You can post them in the comments below, or you can send me an email at contactus@mdencs.com. You can also visit our website at mdencs.com to find out more about our services. Until next time.